Hey, this is Jared with Coherent Healthcare. Really excited to be at Healthcare Summit. We're going to walk around, have a chat with different vendors, specifically interested in speaking to those folks working at the intersection of AI and service delivery. There's a lot of conversation here already happening about how you bring staffing and technology together to deliver a really high impact solution for healthcare providers. Should be a lot of fun. Really excited to take this walk with you. So tell us a bit about what you do. What are you doing here at the conference?
So WebBox help healthcare organizations with their websites and their marketing. So we're at the Healthcare Summit today, speaking with healthcare providers, understanding their pain points around kind of their website, why it might not be delivering the engagement they're looking for. So that's why we're here.
So it's interesting, website engagement, you're an orthopedic surgeon, you're a dentist, you're a dermatologist, you don't go to med school and think about website engagement. It's not really the thing that comes to mind. So if I'm a healthcare practitioner, what should I be thinking about? How do I even know if I have a problem? How should I be thinking about that?
Yeah, I guess it's interesting, isn't it? Because they get into the industry for a completely different reason, but then they are operating a business at the end of the day, right? So they need inquiries, they need sales. All businesses need that to survive. So I think it's really important that they have that mindset where they are looking at the number of leads coming into a clinic or practice. They're looking at cost per acquisition. They're looking at how we can retain customers. All these things need to be factored in. And often they might not have the in-house expertise for it. So it's really important that you rely on someone who's been there, done it, and can hopefully bring some expertise to the table.
So if I'm a clinic, I come to you interested in your services, want to learn more. I know I used to run a clinic, and I know that sometimes people come to you with scars. They come to you with some bad experiences. They come to you with acquisition funnels that are all over the place, data that's all over the place, not really sure how things work. How do you unpick that? How do you even start that journey with the practice?
Yeah, we've experienced the same, unfortunately. So I think it's really important that we take stock up front and we understand what they've tried, what's worked for them, what hasn't worked. So there's a lot of data analysis up front where we're really unpicking what they've done and what their pain points are. So might it be that customers are coming through the door, but the acquisition cost is too high? Or maybe just the lead volume isn't there. So we start to unpick these things and then at that point put a strategy together to help them move forward. But you can't put the strategy forward without understanding what they've done to date. So that's our kind of our first step for them.
It's interesting. So I think one of the things you hear a lot is that parts of healthcare are commoditized. There are a lot of great practice type A, practice type B. You can go here and get it. You can go there and get it. From a brand positioning perspective, from a business growth perspective, how should clinic owners be thinking about differentiation? How should they be thinking about what they do versus what the people 5 blocks over do? Is there a conversation there that you have with them when they start working with you?
Yeah, understanding not just kind of the services they offer, but what makes them unique, I think is all part of a successful campaign, because we need to position them as the go-to. So regardless of what they do, we need to really understand what makes them different from someone down the road. Now, location plays a big factor here, but there are huge other factors where it might be the demographics they're targeting or something specific around how they deliver a service that's unique to them. And once we've understood that, we then build a campaign which obviously highlights that effectively through good ad creative and good ad copy. But these are all part of the conversations that we have up front because for us, it's not a one size fits all. Every clinic, every healthcare organization is different. And it's our job to find out what makes them unique.
I love that. So last question for you. We're sitting down. I'm a clinic owner. What is the one place that I need to start my journey with you? What is the 80-20, the thing that gets more leverage than anything else? What is the first intervention that as a clinic owner, if I'm not doing this, I'm leaving value on the table?
So I'd start top of the funnel. So how can we get more people to come through the door? How can we get more inquiries? And often that is through PPC, so Google Ads, Meta Ads, and other channels like that. And one of the reasons for that is because the way in which we search for these kind of services has changed drastically over the last couple of years. So to break through that noise, ads can often be a good way to generate those inquiries. So yeah, your kind of 80-20 rule, I would start there, but there's lots of other things that you could be exploring as well.
So tell us a little about yourself. Tell us a little about what Exonic does. Help us understand why this matters in healthcare right now.
I'm Abha Chopra. I'm a practicing colorectal surgeon based in London. And my passion has been about healthcare transformation. I've seen so much of suffering due to lack of access or lack of timely access to healthcare that in 2017 I thought I'll do something about it. And my first inspiration was to look at how other systems change in other professions. They all did something very interesting. They became very techno-integrated. Healthcare didn't. So I thought, what is the core problem of healthcare? The core problem of healthcare is that the data doesn't move. Patient doesn't have his data. So we first built a data mobility platform. And once we built that platform, now I'm in a position where I can have integrated AI to really make it appear magical. Imagine I can be sitting in my house and having a consultation in New York, or in Mumbai, or in Timbuktu. And I'm getting real-time advice, real-time opinion. Let me flip the scenario. Let's assume I'm an elderly person who really has mobility issues. I don't even have to leave my home to get proper advice. I don't have to go to a doctor just because his opinion is important. His opinion can come to me. In order to do that, in addition to the AI platform, we've also built something called health ATMs. Same concept as banking. If my patient data is with me, and I can actually see it, I can connect you to any clinician anywhere in the world, that clinician can now assess me. He can examine me, he can actually ask for some minor tests, and now he's in a safe position to offer me the right advice. So the entire ecosystem is about empowering every stakeholder in healthcare.
So it's interesting. What I love about what you described is that patient is at the middle.
Absolutely, it has to be patient-centric. Healthcare is done with being physician-centric. Physician-centricity is what has caused a lot of problems of healthcare. And the reason is, it should not be my availability that decides whether you live or if you don't live. I should be accessible to you whenever you want it. And as a human, even if I want my rest, someone else in some part of the world can help you. And the answer again here is to stop thinking about geography and start saying that healthcare should be without boundaries. I should be able to see an Australian surgeon at 2 in the morning when I had my tummy pain. He can at least do the assessment. And by the morning when the UK surgeon is ready, he has everything done for him. And he can go ahead and do the surgery.
So the idea of patient centricity is sort of acting and delivering around the patient availability, around the patient convenience. Help me understand how, if I'm a patient and I'm using your platform, what does that look and feel like for me?
Fantastic. Very nice question. So from a patient perspective, there are 3 major challenges. One is, I might not have access to a doctor. Number 2 is the doctor might not be the right doctor for me. And the third is I might not speak the doctor's language. So when we built this, we said, listen, let's eliminate all these 3 barriers. So today I've got my own patient app, which actually is my medical file, available to me 24/7, 365 in any language. I have an ability to access a global clinician network, so I can access a doctor anywhere as per my own choice. My doctor has a complementary system where he can't make an error. We've got a virtual autopilot for doctors. And to top it all, I've given a personal health buddy, which is an AI assistant, which will guide you for health matters, to tell you when it's urgent, when it's not urgent, when you should panic, when you should not panic. And basically be there, someone who's your close confidant that you can share your innermost things with, but he can guide you properly. So that's, in a nutshell, what it's for the patient. So in other words, healthcare is now directly in my pocket.
So tell us a bit about who you are, what you're doing here, how you found the conference so far.
So I'm Tom. I'm from Freeths in our health and social care team. Found the conference really good so far. It's been nice to chat to a few people, see some of the talks. Been quite insightful to hear about things going on in the sector. We're we're very much focused on this sector. We've got a specialist team focused on various different legal transactions in the area, whether that's acquisitions, developments, funding. So yeah, really got a team focused on this area, which it's good to get so many people from the sector in one space, which is great.
So if I'm a customer of yours and I come to you, what problems do I have on day one? Where do you usually start your conversation? I appreciate it might be varied. You have different kinds of conversations, but if I'm a clinic owner, or if I'm thinking about a transaction, possibly some kind of liquidity, selling, buying, whatever it might be, what do we talk about on day one when we sit down for that conversation?
I think probably initially just starting to talk about preparation for the transaction, what you need to be thinking about before either going to market for a disposal, for example, how you need to gear your business up or your asset, or trying to be as prepared as you can for going to sale, going to market. Alternatively, if you're looking to acquire, it's making sure you're aware as to what exactly you're looking for in the market, to try and make yourself as prepared as possible, I think. And that's sort of where we come in, advising on the different aspects of what the transaction might look like, and different sort of pillars along the way that you need to sort of look out for and be prepared for, really.
So just imagining for a minute, I'm a clinic owner. I used to be a clinic owner, so imagine I'm a clinic owner, and we're having a conversation about a possible sale, some kind of liquidity in the next months, years. What are my big red do not fly zones, red tape, red line, problem areas, things that I need to really sort out now, so that when it comes time to transact, I don't have an issue, or we don't get stuck in some kind of thorny due diligence? What are your sort of top tips on where to look for skeletons?
I think certainly internal governance, your employment contracts and those kind of side of things, looking at your assets and your sort of, whether it's there's real estate there to look at, making sure whatever asset will potentially be disposing of is sort of ready to market. Each sort of subsectors within the sector will have their own little nuances, so that will sort of depend and vary a little bit. We're sort of primarily focused in the sort of health and in the sort of care home development disposal setting, so which generally is quite a real estate focused area, where that is the main asset. So it's making sure that that asset is ready, and potentially if there's any issues, or we'll almost sort of vendor DD the process to make sure that actually taking that to market is as smooth as possible, to try and avoid any hiccups along the way which might delay the transaction or add any costs along the way.
From a company perspective, Quick AI is an AI company, so we have an intelligent bot system that can plug into multiple platforms. For instance, if you have a care planning software, and you have a financial system, a HR system, you can actually plug all of those into the actual AI bot and query that data, pulling all that data through into one single interface with the intelligence of analytics and reporting and graphing and things like that as well. So it is actually a multi-platform. You can use it in a single platform, or you can connect multiple platforms to the AI intelligent bot.
Got it. So if I'm a healthcare provider, I'm working across a range of scattered systems. Some information is here, some information is there. And what we're doing here is we're saying we're going to give you one point of entry to query that information and come away with insights.
That's correct. And you can also do custom reporting. So if you want like board packs for your board members, so we would be able to pull all of that out. You can actually, all your incident analysis to say how many safeguardings have I had for the month. Give me trends, give me analytics, give me suggestions on how I can actually enhance my own care service to make sure that we actually, lower the safeguardings and make sure that we actually attend to everybody's needs. Auditing of the care plans. It will take a normal person 45 minutes if they're really good. Carrie does it in 7 minutes, auditing all of the care plans, giving you that feedback, inconsistencies, and also you can create risk assessments and things like that from it. From automation, we can do invoice automation, we can do CV screening automation, so that you don't have people sitting reading through all of that data for hours and hours on end. Carrie can scan them through, actually give you a short list and say, these are the people that we suggest, for example.
Really interesting. So I used to work in a clinical environment, and one of the things I know is that the accuracy and quality of the data can be hit and miss. So one of the things I'm really interested in is, how do you handle that as a provider? So obviously you can plug in intelligent systems, as you're describing, but what happens if the underlying data is patchy at best? How do you work around that?
So Carrie would be able to analyze. So, for example, data integrity. So it will show you where the gaps are inside of the data structure, and it will tell you and give you suggestions on how to make that better. For example, if somebody logs an incident like a fall or an ABC behavior, and, some people speak different languages, their way of interpreting things, and you can actually ask Carrie to rewrite that log for you, translate that data, let it make sense. And with integrity that we build into the system, it can give you the data gaps, it can give you all of that information to make sure that you can actually get the data in the correct way to actually produce good quality reporting.
So how have you found the conference so far? Tell us a bit about Newcross Healthcare.
Perfect. Yeah, good. Really, really good. Seems really busy. Over the last few years, you've definitely seen at these events the population of attendees drift down. So it's really good to see this being quite a broad variety of guests from multi places within the sector, whether it's finance, industry, within industry, care sector, supply, procurement. Newcross Healthcare, we're 30 years old. Predominantly a staffing business, so in your time of need, when you're needing additional staff, we're able to support you with that. But as we've gone on our journey, and as most businesses are, they're going on a digital evolution, we have developed out our technology to instantly match with the requirements of our customers. So if you need a nurse tonight, you've set up an account within Healthforce Go, you'll be able to be instantly matched with people in your local community to fill that shift. Second, that is actually how can we take that one step further? Organisations have, some organisations are large and have multiple services, and actually managing that supply chain of contingent workers can become wild, and actually creating consistency and consolidation to ensure that the additional spend that they're spending is being well managed can be difficult. So Newcross has developed a digital middle office. It allows customers to put all of their services within it, all of their third-party supply chain, but level up on some of the core fundamental rules that they need to work by, whether that's compliance, leveling up the compliance and vetting levels, leveling up the insurance levels, leveling up the ways of operational working. If somebody's taking a break, you don't want to be charged for that at the end of it. How do you manage that when it's an agency worker and a care home manager who maybe isn't looking at it as closely as the procurement team are? Big savings that can derive from that. A company that's spending $1 million on agency workers may have an average shift length of 10 hours. The average cost to serve might be £20. You work that through on every shift, that's £100,000 worth of saving of that $1 million just from a digital middle office. That's one initiative, and that's the problem we're trying to solve in the marketplace, is how can the social care and healthcare sector manage contingent labour far better.
It's really interesting. So one of the things that we see a lot with the healthcare providers that we work with is this tension between in-house capability, outsource capability. And how much can my team realistically achieve in-house? Do I have the expertise to cover all of the clinical and operational requirements? And oftentimes I think there's this assumption that I can get it all done with the team that I have. I don't know that that's always the case. So I'm quite curious to hear, in terms of the providers that you work with, if you're thinking about running the business of that organization, how should I be thinking about my core team, my head office, my full-time clinical staff and operational staff, as opposed to folks that I might be bringing in to help me close the gaps, as you're saying, care gaps or operational gaps? How should I be thinking about that as a business owner?
Every business has different problems, and I think some businesses absolutely could double down on their own workforce and manage but you're not going to grow when you're just managing. And so I think that the way that organizations need to start thinking about how they partner is how do they partner for growth, but how do they partner also to drive down efficiencies? If you're an organization that's not a specialist, it's more generic, you might have a lot of requirements for core skills, support workers, healthcare professionals. But actually the problem with that might be absenteeism, sickness levels. Actually, you're paying for that as an employer. So the problem actually to use a temporary staffing pool might pay dividends from that approach. If you're a highly clinical clinic or a highly specialised hospital unit, finding psychiatric nurses, finding paediatricians, hard, really, really hard. So actually then, how do you double down on retaining them, working with them, but building out support networks that allow you to grow so that your growth isn't interdependent with finding more consultants, more paediatricians. And I think, again, these are the digital middle office, but how can actually digital middle offices and tech solutions allow you to kind of take a step back from your organization and look at the direction of growth travel? I think that's what the sector's really doing right now, is it's going, okay, post-COVID, everyone's starting to plateau. People in sector are buying more privately now, and society is more willing to pay privately. But with that, there's a bit more of a B2C and a B2B play in the market to consider. And how do you grow your business in that trajectory? And workforce is always going to be a problem. It's going to be a continual problem. And if you just see it as, I'm going to double down on my own and not think about how I'm going to partner or how I'm going to manage externally, you will be really capped to growth. And actually, I think starting to build ways to partner and club together and unpick problems and develop new business streams through contingent labour rather than necessarily permanent might allow you to try new things. Yeah, that's what I would say on that.
Great. I mean, it's very good to be here. So it's the first time that I'm here. I know we've Sage been here before, but yeah, really glad to be here today. Obviously, here at Sage, we're working with a lot of healthcare-based organizations, so care homes, pharmacies, dental practices, and obviously talking about our financial management system. So we specialize in being able to give CFOs that kind of holistic picture of their financials across different homes, different GP practices, for example, or dental practices.
So we work with a lot of GPs and a lot of dental practices, and I think it's interesting to focus on the CFO's problems. That's not always what you think about when you're running a clinic. You get very focused on patient care, but obviously you're also running a business. So when you have conversation with practice owner or practice leader, what do you talk to them about? What sorts of things are they maybe not focusing on that you can help them focus on? How can you help them bring that sort of business perspective into their day-to-day practice?
So I think when I'm actually going to be speaking a little bit later on one of the panels as well, and what I'm talking about is technology is an enabler. So I think that the common theme that we see in finance is that finance is evolving very, very quickly. And it's the organizations that embrace technology that are not going to fall behind. I think those that don't embrace technology are going to kind of fall off the wagon, so to speak.
So if I'm a dental clinic owner and I'm thinking about how do I bring technology into my finance function, I want more visibility over how things run, what my day-to-day looks like, profitability, cash flow. How does Sage help me do that? How do you help me achieve that visibility so that I know what's really happening under the hood of my practice?
Yeah. So this is where our technology allows practices and that to capture those costs as and when they come in. But it's not like traditionally, obviously, you've got a person who's manually capturing their documents. So we're using things like AI, machine learning to kind of read those invoices in, learn from the interactions that customers have had or employees rather have had with those documents. So that frees them up to focus on what's really important, and that's providing care.
So this idea of freeing up what's important to provide that care, one of the things I'm most interested in is, obviously, as a practice owner, you are a business owner. So you're responsible for your patients, you're responsible for your P&L. How does Sage support the healthcare provision? It's about freeing up time. It's about giving capacity back to the clinic owner. How do we think about Sage meets healthcare as opposed to just Sage as an accounting solution?
So it's really about taking ownership of the data. So I think organizations who embrace technology are moving from kind of being rear view looking, just reporting on what's happened in the past, to actually being able to think forward, actually plan, use AI to do predictive analytics, help to get a little bit more clever in their cash flow forecasting. And this is where technology is not going to replace people, but actually just augment what people are doing.